Good afternoon, everyone. Those of you who are on first, we're going to wait just a minute while folks keep joining. Once the numbers start to slow down a little bit, we'll get started. All right, welcome everyone, and thank you for being part of our staff chat today. My name is Tim Gillette. I'm the Deputy of Operations for the Child Welfare and Self-Sufficiency programs, and I use he, him pronouns. I'll be facilitating the chat this afternoon. Today, from the Child Welfare Executive Leadership Team, we have Assistant Deputy Director, Strategy and Innovation, Alicia Cox, and Assistant Deputy Director of Child Welfare Program and Practice, Lisa Bender. We've also got a few other guests that are going to join us today, and we'll talk a little more about that later. As people continue to join, we'll share a few logistical details. This meeting is being recorded, and we've got ASL, as you can see, and captioning available as well. If you'd like to utilize the live captioning, please click on the CC button that's at the bottom of your screen. And for the real-time interpretation, you can see we've pinned a video on your screen, and you can adjust the window size and zoom to your needs. I'd also like to mention a few housekeeping details as we get started. As I mentioned, this meeting is being recorded, but we won't be taking questions today. We will be sure to plan for extra Q&A time at our next webinar. For any child welfare staff that may be on this call, we did have a similar webinar for child welfare staff a few weeks ago. If you were able to join that webinar, the content today is going to be very similar. Everyone's welcome to stick around, but if you have other things to tend to, it won't hurt our feelings if you don't want to hear the content a second time. Let's see what's on the agenda today. We will be providing updates about our newest executive team member. We're going to hear about continuous quality improvement from our team from District 1 on their CQI efforts, and we'll hear about the next steps on the Doris Duke Foundation grant. With that, let's get started. It's definitely been a busy year so far, and I'm happy to share with you some exciting updates. In March, we officially welcomed our new Deputy Director, Molly Miller, to the executive leadership team. I want to give a brief overview of what Molly brings to the executive leadership team. She began her career 20 years ago in self-sufficiency programs before moving to child welfare. She first worked as a caseworker and then a CPS supervisor. After a decade in these roles, Molly became an operations and policy analyst for child safety programs, where she helped develop guidelines, procedure, and administrative rules, and led initiatives including suicide prevention, the integration of safety science into the CERT process, and the development and application of an equity tool. Molly became a child welfare program manager for District 16 in 2021 and oversaw the permanency, certification, and family time programs. With the help of her leadership team, she established systems that reduced temporary lodging, collaborated with the Offices of Equity and Multicultural Services to address bias and systematic racism in the permanent planning process, and improved data outcomes, including timeliness of family reports and face-to-face contacts with children and parents. We had a very competitive interview process with multiple rounds and community input. And Molly did an amazing job getting through those rounds, and we're so happy to have her join us in this work. Molly's not able to join us today, but we know she'll be on future webinars that you may attend later this year. We're excited to have her here. I'd like to invite Lisa Bender to share a few updates with us. Lisa?
Great, thanks so much, Tim. Before we dive into updates today, I want to say a few words about the lawsuit you may have heard about in the media. While we cannot comment on ongoing litigation, the safety of children continues to be the highest priority of child welfare. Oregon has made significant progress in improving the child welfare system in recent years, particularly around prevention, child safety, and support for resource parents and caseworkers. We know there is more work to do, and we look forward to continued collaboration with our partners, staff, and communities to ensure all children in Oregon are safe and have the opportunity to thrive. I also wanted to provide an update on our work with the Doris Duke Foundation. The foundation formally launched the Opt-in for Families initiative on March 11th. Oregon was one of 4 jurisdictions to receive a grant for $33 million for prevention programs. Other jurisdictions selected include Washington, D.C., Kentucky, and South Carolina. Child Welfare Director April Flint Gerner represented Oregon in Washington, D.C., presenting on a panel at the in-person media event where Rebecca Jones-Gaston, many of you would remember Rebecca as our director, and Senator Ron Wyden from the state of Oregon were the keynote speakers at that event. While April was in Washington, D.C., meeting with congressional leaders, she noticed the national conversation around child welfare continues to focus on improving child safety by reducing child poverty. This includes increasing partnerships and access to quality behavioral health and mental health support to families and supporting the workforce and partners. What that means is that we need to do as much as we can to keep kids safely at home whenever possible, place them with kith and kin whenever possible, and help them get access to concrete and necessary services to mitigate risks to child maltreatment much further upstream. At the launch, leaders from all 4 jurisdictions, including Child Welfare Director April Flint Gerner, as well as people with lived experience, talked about the way concrete material supports can influence family stability and child safety by having community organizations, self-sufficiency programs, and child welfare working together. This work is really just beginning, and this next year we will be designing the pilot program with the Doris Duke Foundation partners. We just held our first meeting with the leaders of the other states in Washington, D.C., and our advisory committee will meet for the first time in April. Alongside Harvard's Government Performance Lab, we are also laying the groundwork with Districts 2, Multnomah County, and Districts 11, which is Klamath, where the pilot programs will be based. I look forward to sharing more updates in our next meeting. Back to you, Tim.
Thank you so much, Lisa. Alicia, could you tell us a bit about Child Abuse Prevention Month?
Yes, of course. Thanks, Tim. Good afternoon. And before we go into some updates, more updates from Lisa and our special guest, I wanted to highlight a few important milestones from Child Abuse Prevention Month this month, in last month in April, as well as this month's National Foster Care Month. 5 years ago, 15 hotlines merged to create one for all of Oregonians, available 24 hours a day, 7 days a week. At this time, Multnomah County was the only one that was a 24/7 hotline. There's so much impressive data that's coming out of the work in the Oregon Child Abuse Hotline, or what we call it, ORCA, is doing very well in improving customer service and child safety. Just one example, ORCA answered more than 131,000 calls in 2023. Let's sit with that number for a bit, 131,000 calls, an increase of over 7,000 from the previous year. And we still maintain the average wait time of under 2 minutes. ORCA has also maintained one of the lowest turnover rates across child welfare with an average of 2.2% for 2023, meaning they did not lose a lot of people on their team and they're able to retain those high quality workers. One of Governor Kotek's directives to state agencies is to improve customer service. And ORCA has repeatedly been held up as an example of customer service improvement and change, which includes consistency, accuracy, and just really appreciate it. So great job, ORCA. Because of these results, leaders across ODHS have been reaching out to learn how ORCA operates and the best practices we have established. I also want to report that our resource champion teams have a lot of events scheduled across the state to appreciate resource families during National Foster Care Month. And of course, social media will be out there with a lot of information to help promote recruitment and share those information about our activities. Back to you, Tim.
Thank you for those updates, Alicia. Next up, Lisa, can you provide an update on the after action review that we had in relation to the temporary lodging contractors?
I have a couple updates I'd like to share with you today. First is an update about a recent after action review that was conducted by our Office of Resilience and Emergency Manage, or OREM, last month. This review was intended to look at some of the issues that surfaced this past year with several temporary lodging providers. The purpose was to provide a neutral evaluation of the department's contractual relationship with Dynamic Life, which served as a provider for temporary lodging supervision and prevention. After action reviews are commonly used in emergency management, excuse me, getting over a cold, to conduct relatively quick reviews of events and make recommendations. Our director, Fairbourse Paxares, has directed leadership of Child Welfare, SSP, OCMP, and ODDS to develop an implementation plan for needed improvements. In addition to the after action review, our ODHS internal audits team has audited our child welfare contracting processes and regulatory controls over contractors and providers supporting children in or at risk of temporary lodging. Based on the results of both the after action review and the internal audit, several improvement efforts are already underway. For example, we have centralized the management of temporary lodging contracts. These contracts previously were managed by local offices. Managing them centrally will provide more consistent oversight and accountability. We are developing a consistent statement of work and contract template for any temporary lodging providers, including areas like safety, intervention, and training. We're increasing mandatory training for contract administrators within the agency. We're reviewing contract requests for child welfare client services to ensure background check language is included in all contracts. While our relationship with Dynamic Life ended in January, we still have providers available we work with to support and prevent temporary lodging. Your local leadership works with our team in central office. We call them the resource management team, as needed for support. Back to you, Tim.
Thank you, Lisa. Next up, we're going to get a quick legislative update from Tristan Fernandez. Tristan, thanks for joining us.
Absolutely. Thank you for having me. Currently, the legislature is in the legislative interim as legislative session ended on March 7th, 2024. However, during the legislative interim, the legislature does meet from time to time, and the next legislative days are at the end of May. They'll be from May 29th to the 31st. At this time, there is one presentation ODHS Child Welfare will be participating in during these days. The legislature has requested a presentation on the Doris Duke Partnership, which you heard about from Lisa earlier in this presentation. While the legislature has not yet posted their agendas, it is expected that this presentation will be on May 29th at 11:30 before the House Interim Committee on Early Childhood and Human Services. In addition to that, I was asked to provide just a quick highlight of the major pieces of legislation that passed and sort of what some of those impacts to child welfare are. During the 2024 legislative session, there were 291 unique bills or resolutions filed. Of those, 104 were assigned to child welfare for analysis, and 30 of those passed bills have some form of impact or implementation requirements for child welfare. Of those, I'll just highlight some of the bigger ones, so that we're but I'm happy to have for folks to reach out around any others that they're interested in. Senate Bill 1557, often referred to as the K-Plan expansion bill, which the K-Plan is a Medicaid state plan option authorized under the Affordable Care Act, which allows states to provide home and community-based services and supports while receiving federal medical assistance funds for those services. This legislation includes various provisions to improve home and community-based wraparound services to children and youth under the age of 21 with disabilities and chronic illness. What the bill does at its core is it directs OHA and ODHS to pursue federal funds to provide youth who have complex health needs that specifically would qualify under an expanded K plan. So it does require federal approval to access those funds. House Bill 4086 was a bill specifically around the scope of child abuse investigations in Oregon and the current response in Oregon to children exhibiting problematic sexual behaviors, and setting up some task forces around that, which you'll hear more about in this presentation later from Lisa. House Bill 4140 and Senate Bill 1579 were both bills impacting child advocacy centers and the funding requirements around them. It specifically requires DOJ to request funding biannually, and it sets up a grant program for current fundings and current CACs. So those are some additional funds that will be available through DOJ for child advocacy centers. Some of the budget highlights that I wanted to point out is $86 million in the general fund was allocated for the employment-related daycare program, and House Bill 5204 did allocate $221 million for various elements of services for behavioral health under as it relates to the changes that were made under House Bill 4002 regarding Measure 110. Of that, the biggest chunk for services was $85.4 million for behavioral health residential beds, crisis stabilization centers, sobering centers, and SUD treatment capacity investments, and those investments were to be made statewide. So those are additional funds that were allocated in the last legislative session. And at that point, those are the highest level overview of kind of what came out of that session. And I am ready to pass it back to Tim. Thank you very much.
Thank you for that, Tristan. Appreciate the updates. And as advertised, we're going to hear a little bit more about House Bill 4086 from our friend Lisa. Lisa Bender, welcome back.
Thanks, Tim. As Tristan stated, the legislature passed House Bill 4086 in March with bipartisan support for a review on the scope of ODHS child abuse definitions, the investigative process, due process, and how we work with community treatment providers to support children with problematic sexual behavior and their families or caregivers. This bill will allow us to convene 2 study committees to look at best practices and prepare to make recommendations to the legislature in 2025. The first study committee will look at child abuse definitions in Oregon compared with other states across the nation, with particular attention to our definitions of threat of harm and neglect. The committee will also consider defining who is responsible for child abuse. Oregon is currently the only state in the United States with no definition related to who is responsible for the care or welfare of a child, and therefore who falls within the jurisdiction of child abuse laws. Most states limit child protective assessments to parents, guardians, custodians, caretakers, or others in a role where they are responsible for the care of a child. Finally, the committee will consider potential gaps and/or duplication of efforts for child abuse responses and make recommendations around more effective coordination during the CPS process between child welfare, self-sufficiency, law enforcement, district attorneys, and all the other first responders and community-based service providers we work with. The second committee will look at services to support children exhibiting problematic sexual behavior. As we continue to make the vision for transformation a reality and center the needs of youth and families, we are often faced with the recognition of where we've caused harm. Assessing a child and placing them on a registry for sexualized behavior can lead to stigma and limit that child's future potential for success. Therefore, we want to explore pathways and access to trauma-informed treatment services for these youth and their families that would not require a child abuse finding in order to get help. quick update on the status of those two committees. We have sent out some information to those who expressed interest in participating on those committees. I will tell you, we had overwhelming interest. I believe the list is about 200 plus individuals. As I'm sure you know, a committee of 200 would not likely allow us to get to the work and the recommendations. So we are currently working with an interagency team with folks from DHS as well as our partners at OHA and OYA in order to come up with some scoring or prioritizing of the required membership roles that are laid out within the actual bill, and also prioritizing folks with lived experience and having a representative committee that includes folks from across Oregon and not simply the I-5 corridor. We are hoping to announce all of those members by July, and we're looking at other ways for individuals we are not able to appoint to the committee to still give feedback, whether that be through focus groups or surveys. That's it on 4086. Tim, back to you.
Thanks, Lisa. Appreciate the updates. Alicia, I think you've got some special guests here with us today. Would you like to introduce them and talk about what we're going to present today?
Absolutely. Just a little bit of background. In June of 2020, I was charged to build a vision and create a continuous quality improvement program. I did not do that alone. Thankfully, I had very motivated and very passionate people, and it was formalized and built from the ground up in early 2021, with you all, with work groups and research and colleagues within child welfare and persons who are really involved with the data. The program started their pilot sites in 2022, and we're nearing the time when all the districts in the state of Oregon have entered the CQI cycle. Some have even finished their first year and starting their second. The Continuous Quality Improvement Program is being recognized nationally for the work and improvement efforts, and this cannot be done without the support of our community. Providers, educators, judicial partners, tribes, and persons with lived experience who spent hours looking at data, going through root cause analysis, and providing feedback on strategies and collaborating on sustainable ways to improve our practice. So I just want to take a minute to thank you all. There's still opportunities to get involved with our continuous quality improvement efforts. There is definitely a call to join in the advisory committee and or be part of the community-led strategies and improvements. So you get to see within your district, where you live in your community, the data, and then also the tangible actions to improve. So today, I'd like to take a little minute or two to slow down and hear from District 1. We have a couple people on the line that I'd like you to meet and introduce, and we can look at their data and talk about their experience in year 1 of the continuous quality improvement cycle. Make sure that everyone turns on their video. We have Tara McLaughlin, Kim Mai, Craig Madsen, and Dana Torrey. And District 1 is Tillamook and Clatsop specifically. We just want to talk about their work today. So I'll have Tara start off with introductions and we'll pass it around. And then I'll go through a little bit of slides and data, and then we'll come back with some questioning.
Hi, everyone. Thanks for having us. I'm Tara McLaughlin. I use she, her pronouns, and I am the Child Welfare Program Manager for District 1.
Hi, and I'm Craig Madsen, the CPS Supervisor here in Tillamook.
Hello, Dana Torrey, District 1 Safety Consultant.
Awesome. And this is the core group that will be talking through our work today. We'll share a couple of slides just to get you grounded in what we're talking about, and then we'll go into questioning. We'll take just a second to load up the slides. There we go. All right. So again, this is just to center you all. This is in year 1. So District 1, Tillamook and Clatsop are actually in year 2. So this is a fantastic opportunity to talk about what they've done in the last year. And with continuous quality improvement, it is a systematic and data-driven process that asks, how well are we serving the children and families in our community? And what can we do better and even more effectively? So we look at data to look at trends, to identify areas of opportunity for improvement. And then from that, with the community-powered persons in the room, not just child welfare workforce, but providers, other agency partners, educators, persons with lived experience are sitting alongside with us to look at our data and also help build out an action plan that is sustainable, something that isn't going to disappear. Let's say if someone wins a lottery and moves out of state to Hawaii. So really, what can we do to build out a continuous, sustainable environment for improvement and implement a process that isn't too heavy on the workforce, isn't too heavy on community, but has tight partnership and accountability. Again, going back to why it's important is that we want to involve persons who have a perspective outside of child welfare. You're working alongside in the child well-being community. We know your perspective is important. We know that you have insights that we don't have, and to garner that involvement and insight as we build out a plan together is only going to make our improvements long-lasting and more sustainable, because we're not looking through a narrow lens or being siloed in our thinking. So it's been pretty involved in having tribes representatives in the space, having resource parents and biological parents and persons who have experienced child welfare. So again, that input and participation has been highly valuable. So where did we start? This is the measure. When we are looking at our data for every district, when we're sitting down in the room for 4 hours looking at data. And 4 hours seems like a lot to be looking at data, but it's a very engaging space. And we've heard good feedback about the opportunity to look at our data and to have a discussion, an open discussion about it. So as the the sites decipher where they're going to work for the next year, where's their area of focus? In District 1, they looked at initial placements with kith, kin, and relatives. So from October of 2021 to October of 2022, they wanted to see where are we now with where we're meeting, where initial placement is with relatives, kith and kin. Where are we getting our kids back with families? Maybe not necessarily in the immediate future, but with someone that they know, their auntie, their best friend, someone that they know that they can trust as they're sorting through some of the stressors in their life. So as we're looking through big picture, children currently in substitute care, where are they currently? Where are the people in Tillamook and Clatsop right now? So 38% are sitting with kith and kin and relative, and we have the rest sitting with general resource home. So as you can see, it's greater than, was that 42%? Am I doing my math right? 4, 5, 6, 7. It's trying to do math on camera is a little difficult. But it's greater than, it's closer to maybe like 60%, 62% that we have with general resource home. And then again, trying to increase that number with relative placement. So what did they do? They looked at initial placement with kith and kin to understand where they are right now as a baseline, because that's where they wanted to improve. They looked at barriers placing children with kith and kin. They do a root cause analysis, say, what are all the challenges, all the factors that are stopping us from placing with kith and kin and relatives? And then they have a couple different strategies in order to help support the conversation, that goal and priority. So they're working with parents as soon as possible to identify them, who's in their network, who can we ask, who can we lean on, rely on to get a kid with someone that they know and trust. And then have a family support meeting prior to the child entering care and having the supportive conversation with supervisors and caseworkers so that everyone's on the same page as to what our final and initial goal and our final goal. And then of course, the frequency is having a weekly team meeting to discuss what are some supports around the kith and kin placement and what can we do to help support them as a child is placed with someone that they know and trust. And as a result, so a year later, they're looking at that information. We're seeing that there is an increase in MET from our kith and kin placement for initial placement. We went from 28% to 40%. And of course, as you remember previously, our general home was around 58%, and now it's at 43%, and kith and kin definitely increased closer to 50%. So you can see by using these small, discrete interventions, we're seeing long-term change. We're not looking for giant jumps to 100%, or we're having 100% place with kith and kin, because overall long-term that may have been a process that's just to do a band-aid, not necessarily look at what are the leading factors from placement. We want to make sure that we're making sound decisions, keeping in mind with the families, their goals, and of course, maintaining safety always. So if doing that, we're seeing incremental changes over time is absolutely our goal. And now I just have a few questions for our group here. Just wanted to have them candidly share their experience through the Continuous Quality Improvement Program, through the implementation, through root cause, and of course, as they're sharing with community partners and persons in the area, what are some of the reflections? So once we get settled, I'll go ahead and ask a few questions for you. Are you all ready? All right, get my video started. All right, so what did you like about the CQI implementation? And then of course, are there any reflections from the past year that you'd like to share?
I like that it, we already valued kind of KitKin placement, but it allowed us to slow down and take a good look at it and see what we can make improvements on and see, discuss strategies. And so it was a kind of an intentional slowdown and a look at what we were already doing and how we can improve it.
Hi, this is Dana. First of all, I want to apologize for my video. It's not very cooperative today. But what I really liked about it is the fact that we were able to take a deep dive into certain aspects of our practice and really bring the community along with us to participate in the direction that we're going and to give us feedback on how we're doing.
And this is Tara, and I love everything about CQI. I feel like it's really in line with our vision for transformation. And in our vision for transformation, we really believe that communities have what it takes in their own community to take care of their children. And so this really gives us an opportunity to partner with all of our community partners and people with lived experience and share our information, share our data, and look at what's working well and what's not working well in a really positive environment that allows us to just say, okay, there's some area for growth, and now let's work together with everyone who has a stake in child safety to figure out how to address those issues and make them better. So we get to share successes, and we get to have people right there working alongside us to improve areas that need improvement so we can really best serve families. So I really love that. I love that the plans are really adapted to meet the needs of the branch, the offices in the district, and recognize that, you know, like in our district, we have 3 different branches, and those 3 branches have really different communities and needs. And so CQI did a great job of partnering with each branch and each community to figure out kind of what works well and what their needs are. And adapted the plans to meet the needs and change as they weren't meeting needs. So there's constant check-in to make sure that things are working well and to make little changes when they're not working well. One of the things that I really learned is that, you know, I'm excited about CQI, I'm excited about data and information, but not everybody is at that same level as me. So I had to really slow down and help create a safe environment to look at data and to just kind of meet people where they were. So, you know, that was really good information for me. One thing that was exciting, and I'm sorry, I could talk about this all day, but one thing that was really exciting was that the measure we chose really was because a parent with lived experience had some buy-in and passion about it. And so that really helped us know where our focus should be. And that was exciting to see happen.
I love the reflections, not because I also can talk about continuous quality improvement all day long, but it's encouraging to hear that the program is flexible enough for you all to feel like you have some ability to choose the direction based on what your community says. And I think one thing that was really, that stuck with me with what Craig said, is that it allowed you to slow down. It allowed you to think about what your commitment was in this improvement space versus, you know, going to what you've done or been doing for a while. And I know that with our vision for transformation, it is putting, you know, families first and working on workforce and looking at our data and using those 3 in a way that is meaningful can be a little difficult because we're charged with a lot. We have a lot on our workloads. We have a lot to address and complete and process and report out. So I appreciated that Craig was had the opportunity with, your team as well to think about what you were working on in this improvement space, but also in a way that allowed you to think innovatively and, family forward in that improvement lens. So thank you.
And I would just add that the shared voice part of it was really important to me, that everyone had was asked to and was invited to share their thoughts and feelings. And I think that, early on, one of the things that I was most impressed around was the way that when the community was asked to participate, they were there. They wanted to have things to say, and we had a forum to listen and to respond to that. And I think that because we do use our data, it helps to create a more level playing ground for how we interact with our community and our partners. Because as most of us know, we really have a lot on our plate, as you said earlier, but that doesn't mean we can't slow down long enough to listen to what people have to tell us. And that's really been, for me, helping to move the district forward. This is year 2 for us. So we have a little bit of understanding, but it's just been phenomenal.
Thank you, Dana. The next question I have would be, what are some recommendations for getting your team or community on board with CQI? So we have people who are not employees of child welfare, or maybe they're in the child wellbeing community. How can they get involved, and what are some recommendations that you'd like to share with them?
I know that what we did is, in the beginning, I talked to the team and helped them understand that they're already doing the work. We're just going to slow down and look at it a little differently. And they care about it. And so it helped them work together, and they got really creative in different ways of gathering information, different ways of talking to people about it. And then when we're out there doing the work too, and you have an opportunity to speak with different agencies or speak with the community or educators or whatever, you kind of explain to them that the whole goal behind it is to have the community be able to help and care for these families and help support them. And then also reach out for different resources or people that can be supportive people. So just to have those conversations when the opportunity presents itself seemed to help out quite a bit.
And then I would really just agree with Craig. I think it's a lot about relationships that we have with people. And, we send out an invitation, but when we really saw people become engaged is when we, reached out with someone that we personally had a relationship to talk about the process and talk about our vision for transformation. One of the things that I like to do is acknowledge that we haven't always done work in the best way, and sometimes that's caused harm, and just to say we're trying to do things differently now, and we'd like to bring you into that with us, into that space, to really look at our practice and be part of a team that is responsible for making things better for children and families. And I think when we send people who have relationships with community partners to talk to them directly based on that relationship, it makes a really big difference in getting people involved.
Yeah, and I would just add to that one of the things I've noticed, and I've been with the agency for a while, 25 years or so, and one of the things I really appreciate about CQI is the intentionality of it, because it gives people the opportunity to air their grievances, but also to be part of the solution. And I can't say enough about the vision for transformation and how it's really, for me, has really was a game changer. And then adding CQI into it. I've been around the United States. I've done several federal reviews over the years for CFSRs. And this seems to me like the best way to approach this work, because we can be reminded that yes, these are big problems, but the solutions are one step at a time. And that's really important to remember, that if we get focused on the big picture, then not focusing on the small steps that get us to that bigger picture gets kind of lost. So one of the recommendations I have every time I get an opportunity to talk about it with folks here in District 1 is to say that you are important to us, and you're important that we hear from you and that you take some time to help us understand how we can make things better.
And I would just add, I mean, one of the things about CQI that's been so cool is that it elevates people's voices, and it gives us an opportunity to celebrate small success and to recognize the, little incremental successes that people are making in a really great way, in an intentional way. And what else happens is that because we're looking at all this data and information during this process, we can say, this isn't our measure, but here's something else that we can impact really quickly in a small way. And so over the last year, we've seen successes in so many different areas because of just a small amount of focus on, something that we wanted to make better. So it's just been really good for staff and good for our community to be part of that process.
Thank you. I just want to thank you, Tara, Craig, and Dana, for joining us to talk about your work and then just your continued energy around improvement. You definitely have incorporated ongoing engagement efforts with your families. You've been doing that before, but the ability to slow down and ask those questions. During our conversation prior to the chat, you did bring up something, Craig, that I wonder if you want to highlight a little bit more, is that your CPS caseworkers and the engagement that they got, you actually hit a milestone in your district where you didn't have anyone enter any foster care because they were all placed with relatives. And I think that is one of those small successes that maybe have been, maybe that's not a small success, it's a big success, but maybe a small part in all of our data and all of our work that we may have missed. And so when Tara talked about having celebration around the improvement, is that continued energy that we have a long ways to go, but it's definitely the ability to share and be transparent in how we show up with our data, how we show up in accountability with our partners and providers and persons who are actively here in support of children and families in the state of Oregon. It's using that in a way for outcomes, like tangible, actionable outcomes. And for me, that's super exciting because I want to see us improve in those areas. And it can be a little uncomfortable on how we look at data previously. It can be uncomfortable recognizing that we have areas that we need to improve. But what we sit in that uncomfortability is seeing the opportunity for improvement and being energized and charged by that option and the opportunity to go down that path and improve in tandem with the community around us and support. So that has been very exciting to hear the work that's happening across the state of Oregon with a continuous quality improvement plan. And again, just thank you all, D1. There might be persons who are part of that meeting on the call right now. Thank you for actively showing up in that way, being curious about the opportunities that we have with our improvement, and just showing up in that the opportunity to know that we're here to do better, show up better, and be better. And in partnership, we can do a lot together. So just thank you all. Have a great afternoon. And that's it for the CQI update.
Thank you.
Thank you, Alicia, and thank you, District 1. We really appreciate you being here. We've covered a lot of information in about 45 minutes, and what a great way to wrap up. We are going to call it a day for today, and we look forward to seeing you all at our next Community Connection on September 18th. Again, thank you all for joining us, and hopefully we'll see you next time.